you very much. My name is Sharon Phelps, and together with my colleague, Sarah Leek, our session today will focus on an overview of the structure and components of the Promoting Interoperability category for MIPS specific to the year 2020. Sarah and I both work for Mountain Pacific Quality Health. Queens has contracted us to help you be successful in submitting data for the Promoting Interoperability category. Sarah and I have both worked with the MIPS program since its inception, and together we've helped hundreds of clinics be successful in reporting data for MIPS. Due to your participation in the Queens MSSP, the Promoting Interoperability category is treated a little bit differently than those that are participating in regular MIPS. We will be reviewing the Promoting Interoperability category from the perspective of a clinic or a clinician being involved with an ACO or an APM. Last year, many of the Queens MSSP participants took the small clinic exception for this category, so this may be new information to you, and this may be a category that you are unfamiliar with. If you have worked in a clinic that is not part of the Queens MSSP and is doing regular MIPS, this information may not be exactly correct for that clinic. So I just want to caution you about that. Okay, Sarah, next slide, please. There's a few important points as we get started. We have several support staff from Queens joining us today. Jade Hinsdale, Stephanie Nobriga, and Kelson Oshiro. So if you have questions specific to the Queens MSSP, which Sarah and I can't answer, they're here to help answer those questions. So we've got the backup and support that we need. Today's session is going to be offering CMEs. Near the end of the session, we will post the evaluation questions and the test questions that you need in order to get CMEs. So ensure that you complete those. Also, we'll be doing a follow-up email to make sure that you get that evaluation sent out to you again tomorrow in case you don't get a chance to complete it today. Even if you don't need CMEs, we really appreciate when you can fill that evaluation out, as it helps us improve the sessions that we do. We will also be sending out the slide deck and the recording after today's session, and Queens is going to be putting that recording and the slides on their website as a reference for you. As I stated earlier, some of this may be new information for you, maybe all of it is new information. We encourage you to ask questions, either using the Q&A option at the bottom of your screen or using the chat box, and we'll try to get your questions answered. If we don't get them answered in today's sessions, we'll follow up with you afterwards to make sure we get that taken care of for you. Okay, so the first topic we're going to cover today is some terminology. At the end of the slide deck, we have a whole list of acronyms, but these are two items that I want to make sure you understand where we start. Thank you, Sarah. We are talking terminology. The first is the term MIPS. Legislation was passed, federal legislation, in 2015 that gave us the Quality Payment Program, or QPP. This program has two major components, and those two components are focused on rewarding value and outcomes in healthcare services that are delivered specifically under Medicare. One of those, the Merit-Based Incentive Payment System, or MIPS, is the one that we're going to be looking at predominantly today. The second component, the APM component, which stands for the Alternative Payment Model component, the Queens MSP is actually an APM. In order for APM participants to not have to do MIPS, you have to meet certain qualifications at the program level. The Queens MSSP as an APM isn't quite there yet. So that means even though you're participating in the Queens MSSP, you still need to report MIPS. And we'll talk about that throughout the session today. The MIPS program has 4 categories: quality, improvement activities, promoting interoperability, and cost. Next slide, please, Sarah. Okay, let's start by reviewing some of the basic components of the PI category. So the first thing we're going to talk about is the performance weight. This determines how you get a MIPS score, and based on the MIPS score, it determines whether you get a positive or a negative payment adjustment to your Medicare Part B payments. This is independent of any payment adjustments that are made as part of MSSP. This is separate from that. So the MIPS APM performance category weights, the quality category, you get 50% weighting in the quality category. Queens is responsible for reporting quality, and later, end of this year, beginning of next year, they will work with you on gathering the data that is needed to be able to report the quality data. The improvement activity category has a 20% weight towards your final MIPS score for the year, and all of the activities that the MSSP does count towards the improvement activities. So Queens will be reporting those improvement activities on your behalf. The third component is the promoting interoperability component. This is the piece that interacts and deals with your electronic health record. So that component, because it is your electronic health record and each of you can be using a different system, each clinic needs to report that information independent from Queens. That is not something Queens can do because you each have your own system. The MIPS APMs have a different set of category weights for the final MIPS score than those that are doing regular MIPS. You'll notice at the bottom of the screen, MIPS APMs do not have a cost category component. And that is because you are participating in that alternative payment model with Queens. So that's why you don't have to do the cost category. That also explains why today we're going to focus our discussion on promoting interoperability, because that's the one category that you as a clinic are responsible for taking care of and reporting. Okay, next slide, please, Sarah. Here's a kind of a timeline and a list of steps of things that need to be done for this category. First is understanding the reporting requirements. We are taking care of that today. We're going to talk about that. Second is reviewing the requirements that your electronic health record needs to meet. Your electronic health record needs to be what's called a CERT, which stands for Certified Electronic Health Record Technology. There are specific requirements to be considered a CERT system, and you have to be a CERT system in order for you to be able to report the data. So we'll talk about that in more depth. The third thing is to make sure you are reviewing the measure and the performance period requirements so you know what data you are going to be reporting. The fourth thing is performing and reviewing a security risk analysis sometime within this calendar year. We'll talk more about that. And then the last step is actually submitting the data. We are not going to talk about submitting data today. We're going to do that in a future training session because we have enough to talk about right now to get you started on steps 1 through 4. Next slide, please, Sarah. So the first thing is, let's talk about the reporting timeframe or the reporting period. For the promoting interoperability category, you need to report data for at least 90 consecutive days. You don't have to do the whole year. You can if you want, but you can pick any 90 consecutive days within 2020 to be able to report. So, a couple important things to know. First, The last time frame you can pick to start your 90 days is October 3rd, 2020. If you pick a later date, you won't have a full 90 days. So if you haven't already started looking at this data, you want to make sure that you have things in place to start no later than October 3rd. The second thing is you need to make sure your 2015 edition functionality of your EHR system is in place. Now there's a couple different ways you can tell that. We're going to talk about that, but one of them is to ask your EHR vendor. So if you don't know if your system is 2015 edition software, that's a good question to ask your EHR vendor. The second thing is you need that functionality from 2015 where you can use it no later than October 3rd, but it actually has to be certified by a certifying body by the time frame ends, which is December 31st, 2020. Again, that's a question for your EHR vendor. Has your system been certified? Is the functionality there, and has it been certified? The other thing you can do, if you already have your system in place and it's you've had the functionality for all of 2020, you can run any number of different 90-day timeframes to see what your performance looks like at any given time, to see what your score looks like. So Sarah will talk a little bit later about how to go in and see where you can tell what your performance is within your system. We know that COVID may have had an impact on how many patients you were seeing, the method by which you were seeing those patients. So that all can affect what performance results you have gotten for 2020. Next slide, please, Sarah. Okay, a few more important points. We already talked about you must report for a minimum of 90 continuous days, but you can report any number of days, anywhere from 90 to 365. So it's up to you what time frame you want to pick. That's your decision. Another thing that is your decision is you get to pick whether you are going to report by individual or by group. So if you are a practice that has 3 providers, you may wish to report the PI data for each of those providers individually, and your EHR should let you look at how each provider is performing in this category individually. So you can report 3 times, once for each provider, or you can report at the group level, which means you take all the data together and report it all as just one group score instead of 3 individual scores. The last thing is, if you are going to report as a group, then you report that group data all combined for one time frame. You can't pick the best 90 days for each provider and then add that together as a group score. For a group, you have to use one single time frame. Next slide, please, Sarah. Okay, next we're going to talk about the PI requirements. So there's 2 categories of items that have to be completed in the PI category. One of those is called requirements and the other is called measures. Requirements are items that you have to do, and you have to do them or you get a score of 0. You actually have to answer the questions for those before you can actually put any data in when you do this submission. So you have to do those or you get a 0 score, but those requirements don't get you any points. So you don't get a score for those requirements, you just have to do them. The second thing is a measure. Most of the measures contribute to the score, with the exception of there's a couple yes, no questions that if yes, you get the points, if no, you don't get the points. So measures are going to contribute to the score, requirements are not. Next slide, please, Sarah. Okay, if you are going to take one slide from our discussion today to kind of use as your short, sweet little summary of what needs to be done, this is the slide. This is the submission requirements of everything that has to happen in order for you to get a score in the Promoting Interoperability category. So the first item on the checklist is that you need to collect your data in a 2015 edition certified EHR technology system. We've talked a little bit about that. The second item is you have to submit yes to the prevention of information blocking and the ONC direct review attestation. And we're going to talk about that on the next slide. The next thing you have to do is you must complete a security risk analysis in the calendar year, and you have to be able to say yes to that. The next item is report the 6 required measures, and Sarah's going to go through those and talk about what the measures are and what their exclusions are. And the last thing you have to do when you report is you have to tell them what your certified health IT product number is. You're telling them which EHR system you are using, and we're going to show you how you can get that number in just a minute. Okay, next slide, Sarah. So let's talk a little bit more about the EHR requirements for the Promoting Interoperability category. You have to use the 2015 edition. The functionality has to be in place by the first day of your 90-day reporting period. So all of the abilities that are in that edition have to be loaded into your system. And then it has to actually be certified by the Office of the National Coordinator, or the ONC, by the last day of your performance period. So if you got your 2015 edition put into your system this year, it's important you know what date you got the functionality and what date your system was certified. And then you need to find that certified health IT product list number. They call that the chapel number. And we'll talk about that again in just a minute. Okay, next slide, please, Sarah. Queens sent out an assessment to every clinic for you to complete. This assessment is to help get a glimpse of how you are doing in the PI category, as well as a starting point to gather the information you need when it's time to submit in early 2021. We're going to be referring to this assessment throughout the presentation so we can explain what is needed and why. So the first questions here are, who is your electronic health record vendor, and what product are you using from them? What specific version of EHR are you using? And there's some helpful hints on where you might find that in your system. And then the last thing is, where do you get that chapel number? And we've included in this assessment the link to where you go do that. Next slide, please, Sarah. Okay, when you click on that link to the chapel website, this is what you are going to see. This website has a list of every single EHR system that has been certified or is in the process of being certified. So you can enter by different, like the name of your vendor, like Elation or Epic, or by the name of what software version they are using. So you go in there and you search, and they'll have a list of everything that they've certified for your EHR, so you can see exactly which version you are using. And when you click on that, it's going to generate that chapel number for you to be able to use when you report in the PI category. And again, we've got an overview link on this slide, as well as the product list link to get you to this page. Next slide, please, Sarah. Okay, the next items are the prevention of information blocking and the ONC direct review attestation that you need to click yes to both of these requirements. One of the things that is important in the PI category is that you are not doing anything to block the exchange of information out of your system. This is required by the legislation that actually gave us the quality payment program. And there have been a few tweaks to this over time, but essentially what you are attesting is that you have not engaged in any activity that would knowingly or willfully keep your system from exchanging information with other electronic health records systems. And I believe Mary is going to put a link in the chat to a document that has quite a bit more information on that than what we can cover right now. The second item is the ONC direct review attestation. When you submit, you also need to submit yes that you are aware of the requirements to cooperate in good faith with the Office of the National Coordinator if they have some reason to believe that your system is blocking information, or if there's something else happening. There's three circumstances where they might do that. One is when there's reasonable belief that the system may present a serious risk to public health or safety. The second is when reviewing the system presents practical challenges for the ONC and they actually want to see a system in use. And the third is when there's a reasonable belief that the health IT developer or the software vendor has not complied with the requirements that they have to comply with. Next slide, Sarah. Okay, the next item we have is the security risk analysis. You must check yes that you have done one of these in 2020 or you will get a score of 0. Doesn't matter what else you've done. If you haven't done your security risk analysis, you get a score of 0. So a couple of very important points on this one. First, this must be completed to the Office of the National Coordinator Standards, and they have a whole outline of what things need to happen in a security risk analysis. Please make sure you understand that if your vendor says to you, oh, we do a security risk each year, you don't have to worry about it, that is not sufficient. That is not going to cut it for promoting interoperability. There's a number of things that your vendor can't do. Some of those may be things like physical protection of your machines, where you can access patient health information. How do you handle when you get a new employee or when an employee leaves? What are your policies around that? So some of the risk analysis is looking at your policies as well as the procedures with the system itself. So please don't just rely on your vendor to take care of doing the security risk analysis, because there's more pieces to it than that. It must be completed within 2020. Now, if there's a list of actions that you need to do, you don't necessarily need to get all those actions done. You need to get the analysis done, and then you can continue to work on the actions. This security risk analysis is yes, no, you've done it or you've not. Now, there's a couple different ways you can do this. One of them is there's a do-it-yourself tool, and there's a link on this page that you'll have when you get the slide deck of that do-it-yourself tool that you can use to do your own security risk assessment. They have updated this tool in the last year, and it is much better than what it used to be. So that's the good news. If you feel like this is way outside of your comfort area and just more than you can try and figure out on your own, there are people that are available, companies, individuals, to help you walk through those. We have one of them at Mountain Pacific. She does charge a fee to do that, so I want to tell you that right up front. But if you want to contact her and find out what the difference between what she does and the do-it-yourself tool is, we've included her information, but please don't feel like this is any sort of pressure to use her. Just know she's there, available. Okay, next slide, please, Sarah. Okay, you will notice on your clinical assessment, there are questions about when you last performed a security risk analysis, who performed it, what information is there, just to help you as a reminder that this does need to be done. And then it also has the link to the free do-it-yourself tool for a risk assessment from CMS. Okay, Sarah, I think I'm handing it over to you. Thank you.
Thank you for joining, and we are going to get into the measures now. I just want to remind you that this is the first session, but the next session we will get into the measures in more detail. So I'm going to briefly go through them and give you some general information about them, and then I think the 23rd we have another session and we will go a deeper dive into these measures and how you can achieve them. First of all, these performance measures do contribute to the PI score, and they're divided into the 4 objectives. So you see on the first column, the 4 objectives, and under those objectives are measures that must be met. The reporting requirements can be either a yes or no, as you can see on the right column, or they are a numerator denominator. If they are a numerator denominator, that means they are scored based on your performance. And that's why the available points can range from 1 to 10 or 1 to 20 for the different measures. So again, you either have a yes, no, or you have a numerator denominator for these measures that you are reporting for 2020. The first one, e-prescribing, is one of the things to note on this is that for most of these that are the performance measure based, you have to report at least one of one. So you should have a 1 in the numerator and 1 in the denominator. Now that's not going to give you a large score. You know, you'll get a 1 score, but at least then you have met that particular measure. If you don't score at least 1 in those, you will not pass that particular measure. So for electronic prescribing, it says at least 1 permissible prescription written by the eligible clinician is queried for a drug formulary and transmitted electronically. This is one we've had for several years under the MIPS scoring, so hopefully that's familiar with you. There is also a bonus after that if you do a query of a prescription drug monitoring program, then you would be able to get 5 bonus points. And that has to be at least 1 again. But so that is under the objective for e-prescribing. The health information exchange is it's commonly the challenging one of all of the measures. So they need to check with their vendor to ensure all of the parts and pieces of this process are implemented. And you must understand your workflow and how to complete both the sending and the receiving. So under this, you have support electronic referral loops by sending health information, and you have another one that's 1 to 20 points that is referral loops by receiving the information. Again, you have to have at least 1 sending and at least 1 receiving to pass this. Otherwise, you would need to claim an exclusion for it. And we'll get into that into the next session, but just again, I wanted to give an overview of these measures for you. So it's really important to look at this and see if you have numbers, if these are reporting in your system right now. The third objective is provider to patient exchange. So this is where your patient, for at least 1 summary of care, that your patient is able to reach that summary of care. And a lot of this is through your patient portal. They do have access to their health information, labs, or any information that from their visits and their medications, etc. So this is normally through their patient portal that you would have this. The next one is your public health and clinical data exchange. The MIPS eligible clinician has to say that they are in engagement with a public health agency to submit data for these public health registries. and they have to have 2 different public health registries that they're saying that they have. There are some combinations, and we'll get to that, I believe, on the next page, so that you can see what is more entailed in these public health registries. So again, on the clinic assessment, there were some questions about a dashboard for your EHR. That's where you would find these measures and how you are performing for these different measures. And it has been requested that you do provide a report. Now, if you are in the Queen's Epic system or you have given remote access to the Queen's MSSP, then you would not have to do this. But if you're on a different EHR system, they're asking to please provide a screenshot of your promoting interoperability measures by September 16th. I'm going to show an example that we were given for the Elation, just so you can get an idea. All of the EHR systems are a bit different. There should be a similar landing page that has a report tab. So number 1, as you can see on this, is the reports, and you would pick the promoting interoperability measure report. You may have quality measures and others, as you see here, but you would want that promoting interoperability. And most likely it will ask you for the report type, like the time period you're looking for. In this one, 90 days, and then it asks for the ending week. Oftentimes it'll ask you for the beginning and ending, or just the beginning date of that 90-day period. But this is an example just so you can look in your EHR, if you have not before, to see what reporting capabilities you have. This is the example of the dashboard that comes out of the Elation. It is for the 90-day period, and each of your EHR reports from the different vendors will most likely be unique, but I do want to point out some items to watch for that help in your determining if you're reaching status of those measures, or if there may be some potential issues that you may need to check into more. For this report, the green check mark shows that you have met the specific criteria. For example, look at the second check mark. That is support electronic referral loops by sending health information. Remember, you have a sending health information and you have a receiving health information. For the sending one, you can see there's a score of 6/11. The minimum required is 1/1. And so this criteria has been met at a 54%. That will give you approximately a score, say this is 1 to 20 points, would give you an approximate score of 10 points on this, just to understand what these numbers would mean. The criteria of at least 1, again, is met. So this is just one example of what your dashboard may look like. And we are going to come back to this when I explain a couple other items for filling out your assessment. So as far as public health and clinical data exchange, you must be actively engaged with 2 of them to earn the maximum 10 points. You are, there are several scenarios in actually reporting this one. You may submit an exclusion for one measure and then submit yes to another, and you'll still earn those 10 points. You can claim 2 exclusions if there's proof that there are no available registries or exchanges to report to. And then if you can't report and cannot take an exclusion, that score will be 0 for this category. And we will speak more about this, but in checking, I will be checking with Hawaii and what they have available. And I know that they will give you a lot more detail on what you're able to report, or if there is ways that you can take exclusion. So your clinic assessment also had these questions on it. Does your EHR have health information exchange capability? And this is, do you have that capability of sending a summary of care document? And again, one thing to look at is in this report, I'm going to go back just so you can tell. In this report dashboard, you can see that the electronic access to health information for patients, this is the HIE, and it does have numbers in it, quite a high score. So that capability is available within this particular EHR. You would, when you run that dashboard, you would want to look and see if you do have numerator denominator numbers. And if not, it could be a couple of reasons. One of them being your workflow again, that you aren't doing the workflow correctly, or there does need to be something turned on or a setup done within your EHR to make sure that this functionality does work. So it's very important to talk to your EHR vendor or your IT personnel if you do have someone that is managing this EHR for you. Another area as far as the registries, again, I wanted to mention to you, you would see in here, oftentimes you'll see if you are hooked up to that registry, it will say yes, but you really need to count on talking to IT or talking to your vendor to verify that this is set up appropriately and that the data is being sent electronically, because this measure means that it needs to be sent electronically. And this is that second one, if your IT staff or vendor to check what registries are available. As you can see, there's immunization, there's case reporting, public health registries, lab, syndromic surveillance, clinical data, or there are no registries available. One of the things that we wanted to capture is if you are reporting to a specific, a specialized registry, that would be really nice to know within your EHR. And please write that in also if these categories don't allow you to click on one of the boxes. And again, we'll have information as to what can be available. I do understand syndromic surveillance for the state is not available right now, and that immunization, they are not taking, anybody at this moment as backup to start getting them set up with their immunization registry. So we will look for ones that you can submit to if that is available with the state. So promoting interoperability exceptions. We're going to talk about the exceptions. And this would be exceptions based on the promoting interoperability category in general. Some clinicians can be accepted from promoting interoperability automatically, or you could do that by request. So on the left-hand side is a list of those clinicians that will be automatically accepted, and that's based on special statuses or their clinician type. So these clinicians will not need to submit a promoting interoperability hardship exception application. Most of these clinician types listed on the graphics are accepted from reporting the PI category. So one of the reasons is that these clinician types did not receive the incentive funding to implement EHRT systems. So they are now not held harmless for that PI category. You can also see if they're ambulatory surgical center, hospital-based physicians, or non-patient facing. But I would say most of you would fall into the categories of some of these other specialty clinicians. On the right-hand side are a list of those circumstances where promoting interoperability hardship exception can be submitted. And those, you can see one of them being small practice. If you have a decertified EHR technology, your vendor has not certified to the 2015 version. If you don't have sufficient internet connectivity, you face extreme uncontrollable circumstances, and then the lack of control over your EHR. So you would need to submit a 2020 promoting interoperability hardship exception by December 31st of 2020. There is also this year specific hardship for COVID-19 exceptions, but you would have to really read the fine print carefully because there's some really important requirements you must meet to be granted this exception. Additionally, please make sure that you contact and you work with Queens MSSP before you do submit for a hardship, because I know that there is going to be some decisions after looking at your dashboard, and then just a lot of considerations as to who could be taking hardship versus who we're going to try to keep moving forward and reporting for the PI category. Again, you must submit a PI hardship by December 31st, 2020. And then if approved, that clinician or group does not contribute to the MIPS APM PI score. You're asked to please keep that documentation, because it's very important that you have documentation in case of being audited by CMS. So the PR category exceptions, if you're automatically accepted or you have been granted a hardship, you do not submit anything in the PI category for the QPP portal. If anything is entered in that PI portion of the quality payment portal, CMS will use that as a signal that you have an intent to opt in and to report in the PI category. There isn't a special flag that must be used to tell CMS you wish to report in the PI category if you are accepted. So just the caution is, if you are automatically accepted, don't report anything through the quality payment program site, or else that score, or you will be considered that you are submitting. So don't accidentally do that. And if a clinician decides to report at the group level, they will need to report all the data from all the MIPS eligible clinicians. Again, make sure that you talk with the Queens MSSP to make sure that you should file a hardship exception versus submit your PI data. Okay, we're going to look at alternative payment model scoring standards. So clinicians can report in several ways. They can report individually at the NPI level, or they can report as a group at the clinic level or the tax ID number, or they are allowed actually to report both the TIN and the NPI level. So if they report at both the tax ID and the NPI level, CMS chooses the higher score to include in that APM score. If a clinician is accepted and they do not report that PI category, then they are not calculated into that APM PI score. If all clinicians receive a final MIPS APM score, regardless if they are contributing to that PI score or not. So whatever is calculated for that APM PI score will go for all clinicians within that APM. So for some key dates for clinics or providers are noted on this slide. So we have been reviewing those various sections within that assessment that you had received, and we're asking to complete regarding the current state of your EHR and your readiness or preparedness for reporting that promoting interoperability. That was requesting that by September 14th, which is next Monday. On September 16th, next Wednesday, the Queens MSSP staff has requested that you send the screenshot of your of your promoting interoperability report. Just run that if you, hopefully you can find where that report is and run a screenshot of that. This will be reviewed to identify clinics and or providers that are to continue activities for reporting those PI measures. So around September 23rd, you will know if, get some kind of feedback about reporting. And then again, on the 23rd of September, we will be providing a second training session. And it's going to be more in-depth into the measures and how to report to be successful in the reporting for promoting interoperability. The healthcare, though, so the HCQIS is called Healthcare Quality Information System, and it's the CMS system responsible for the various quality reporting applications. So the HICS, or they call it Access Roles and Profile. So that stands for HARP. The HICS Access Roles and Profile is HARP. So if we keep talking about HARP, do you have a HARP account? That's what we're talking about. It is a secure identity management portal provided by CMS. So this is where you create an account via the HARP. HARP provides users with a user ID and a password that can be used to sign into your CMS applications. And in this one specifically, we use it so you can get into that quality payment program report and the site so that you can report for promoting interoperability. This is a help sheet that will be sent out, and it is a check sheet for you if you do not have a HARP account. You can follow through with this and sign up for that HARP account. It is necessary so that you can report the promoting interoperability measures, or if you have been identified to submit a hardship exception, you will go into this account also to submit for a hardship exception. Again, you will be provided this checklist, and then you should be able to register and log in. On your clinic assessment, it does ask if you do have a HARP account, and it gives you a link where you can start. The clinic assessment asks if you do have that. If not, there is the link. Hopefully the process and the steps are clear to follow. Most likely it's, whomever works on QPP for your organization would be the one that would sign up for this HARP account. If you do need help, there is a QPP help desk, and there's also a HARP related access account number, which is the 1-866-288-8912. If you do have further questions, and Stephanie Nobriga can help you. She has started, she has set up an account, but your most help will come through the QPP or the HARP help numbers. As far as CME and evaluation, again, how to obtain your credits and your evaluation. First of all, please, you must provide contact information and correctly answer the first 3 questions of the evaluation that will show up. Your contact information is important so that you can receive that credit that you have earned. We also request that you complete the evaluation so that we can use your feedback to better prepare for the next session and to include information or suggestions that can improve on this educational experience for you. The slides will be prepared and provided for your reference. So we'd like to know, are there any questions in the chat box or the Q&A, or do you have any questions at this time?
Hi, Sarah.
Hello.
I don't see any questions in the chat box. We do know from talking with Stephanie that some of the questions she has gotten from people who have completed assessments are, why do I have to do the promoting interoperability category because I didn't do it last year? As well as What about the security risk assessment? Do I have to do that every single year? So I think those are two questions that we know have been asked. Which one of those would you like to take?
Well, you go ahead with the security risk analysis. And the second, what was the other one?
The second one is, if I didn't report the PI category last year, why do I need to report it this year?
Okay.
So I can talk a little bit about the security risk assessment. That is required every year. Now, if your system, if you had a security risk assessment done in 2019 and you had absolutely no changes made to your system in 2020, you do not need to redo the assessment. You need to keep working on the action items. However, most of the time the vendors are adding items into the system. They may be doing a whole variety of different upgrades for different reasons. So almost everybody each year needs to redo the security risk assessment because their system has changed. And things in your office may have changed. You may have some very different requirements with how you're using telehealth and different things of that nature in light of COVID. So we recommend a security risk assessment every single year, unless you know for sure your system has not had any changes and you had one last year. Back to you, Sarah.
Okay. There could be several reasons that if you didn't report last year, you may report this year. One of them is your statuses may have changed. So one of them was if you were new to Medicare or you were a new provider, you were granted an exception, but that status again may have changed. So we do need to check into each of the providers and the clinics to see if that is the case. Another is that we never know what CMS is going to change next year as far as who's going to have to report. And if you have the capability within your EHR and you do all this activity and your numbers do show well in the dashboard, it's a really good way to gain the experience and an understanding of how your EHR works, and also begin participating in case next year you are one of those that has to report. And again, we don't know, the next 21 version of the promoting interoperability is out. There's a review period now, but they may be changing what the requirements are. Sharon, do you have anything to add on that?
I do.
Okay.
One of the reasons why Queens wants to see your dashboard is if you are doing really well in the PI category, you can add to bumping up the PI category score for everybody in the MSSP. And so your strong performance can really help everybody. So even if you're a small clinic and you could take the exception, you have the opportunity to help bump that score up for everybody across the board. So last year, the MSSP just needed to make sure that everybody had taken the exception, except for those that were not small clinics. They definitely had to report. And for the MSSP, they had to make sure people were reporting or taking the exception. This year, they're looking at the score and what that score looks like. And so that's why they really want to see where people are at. Like Sarah said, we don't know if that small clinic exception is going to go away at some point in time. And it is a really good idea to get familiar with this category, as well as to start doing things like managing those referrals electronically, managing the prescriptions electronically. Those are some efficiency measures, and they do help drive down costs. So that's why what we want to encourage as many people as possible to use their electronic health record and be aware of these measures. Even if your score isn't very well and you can take the exception, ideally you move towards having a higher score and being able to participate even in the future. Okay, Laura has a question for us. As she says, I understand electronic prescribing of controlled substances. will be required starting January 1st, 2021. I'm going to have to look into that, Laura. I don't know that if that's at the federal level or if that's at a state level. So we'll dig into that and we'll get a follow-up on that one for you. Okay, the next question we have from Stephanie. Sarah, can you quick flip back to, we don't have any, to the HARP information. So this year, which is different than last year you could just go onto the QPP website, find the exception application, and complete that from the website. You did not need to go into HARP. This year, you do need to have a HARP account in order to be able to go in and file that small clinic exception. That's something new. And anybody can get a HARP account. You don't actually have to be hooked to the clinic. But in order to submit that request, you do need a HARP account. Most people get a HARP account without too much trouble, but once in a while people trip up and there's some issues with the identity proofing that can cause problematic. So we encourage you to start on this sooner rather than later. Okay, I think that's all the questions we had, Sarah. Thank you.
Yep. And I did want to show that in these slides, you will have some links. This is a quick start guide that you may want to read through. And then also updates, if you wanted any updates from the Quality Payment Portal site, you can go ahead and sign up for their newsletter. The next slide is some resources we thought might be helpful for the Promoting Interoperability. So if you wanted some light reading, you could certainly come here and look at that. And the acronym list that Sharon had mentioned, some of these things that we were talking about, we probably said them and didn't realize it. And here's what they meant when we'd say EC or HARP or IA. So. All right, and I do know that the link was put in there for the evaluation. So please make sure that you do that and do provide feedback and things that you'd like us to make sure that we cover for the next session. That will be very helpful for us. Anything else?
I am not seeing anything, Sarah.
Okay.
So with that, we want to thank you for your time and attention today. We will follow up on the one question from Laura, and we'll see you again in a few weeks at the next session. Thank you and have a great afternoon.
Yep. Thank you.